this is a technically demanding surgery and takes its toll on both the surgeon and the patient. So I think the results are very interesting. Dr. Epstein?
Thank you. I certainly agree that it's interesting. I think it's a very important study and particularly an excellent example about how less is more, which is something that we've seen in other studies at this meeting, and is a very important principle that despite the fact that this is used in some places, as Dr. Quenet had mentioned, we need data like this to demonstrate whether there is or is not a benefit of the additional thing that we sometimes use without such data. And I think it's very, very important that we could have a study like this to be able to show the lack of role for HIPEC in addition to surgery. And in terms of all patients with a peritoneal confined colorectal cancer being considered for surgery, I think that that's fair to say, and I would argue that they should be put on studies like this, if possible, in order to further demonstrate what helps and what doesn't help.
Dr. Quenet, can I follow up with one other question regarding the experience of the surgeons who participated in the study? So this is a multi-center study, many hospitals throughout France. Were at each of those hospitals, was it a single surgeon who operated on the patients in this study? Was it just any general surgeon? Did you in some way train or qualify the surgeons?
It's a very important question because the quality of the surgery is so important for those patients. And there were only experienced center, and 75% of the patient have been included by only 3 very experienced, very high volume centers. So I think the quality of the surgery is quite good in this study, and our resection rate is 90% in both arms.
Mm-hmm. So it seems to me one important message is that although each patient, as you pointed out, who has peritoneal carcinomatosis should be considered for surgery, where they have the surgery and the experience of the surgeon is likely to be important.